Hollywood actor, who even played God in Bruce Almighty, owes a lot to his voice, yet in 2008 it was nearly lost. The actor's life changed when he was involved in a major car accident that saw his car flip and roll over. Both Morgan and his passenger were left with serious injuries, but unexpectedly to Morgan the event also triggered a condition that he would live with for life. Although keeping his health quite private, it is known that the star was diagnosed with fibromyalgia, a disorder that causes long-term pain all over the body. In an interview with Esquire magazine, Freeman discussed not being able to do certain activities after his diagnosis. He said, "There is a point to changes like these. I have to move on to other things, to other conceptions of myself. I play golf. I still work. And I can be pretty happy just walking the land." Despite his positive outlook on how the condition has changed his life, he still admits that it can be extremely hard to manage. Diabetes, the cholesterol-lowering drink that reduces high blood sugar within 30 minutes. Morgan continued to say, "It's fibromyalgia. Up and down the arm. That's where it gets so bad. Excruciating." Giving up sailing the Caribbean, Morgan revealed that he can no longer trust himself to drive the boat with one arm. Like many with the condition, Morgan tends to feel like he needs to hide his pain. He said he often finds himself acting in order to disguise the symptoms of the condition. The condition is believed to be caused by the way your brain and spinal cord process painful and non-painful signals. The condition tends to amplify the painful sensations and led to individuals experiencing more pain than usual. Pfizer booster shot, the side effect reported in 83% of people. Inside Dave Meyer's health, the hairy biker devastated after diagnosis, latest dementia, 5 early warning signs of Alzheimer's, tips. Theories also suggest that the condition may be caused by irregular activity within the central nervous system, as the pain is caused by the brain and not a result of physical or mechanical problems in the body. Like Morgan stated, symptoms often begin after an event, such as physical trauma, surgery, infection or significant psychological stress. The Mayo Clinic describes the most common symptoms as the following: widespread pain. The pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. Fatigue. People with fibromyalgia often awaken tired, even though they report sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders, such as restless legs syndrome and sleep apnea. Cognitive difficulties, a symptom commonly referred to as fibro fog, impairs the ability to focus, pay attention and concentrate on mental tasks. These symptoms can also be accompanied with headaches and/or migraines and irritable bowel syndrome, IBS. Currently there is no cure for fibromyalgia, but treatment consists of medicines such as antidepressants and painkillers, therapies and lifestyle changes. The NHS recommends cognitive behavioral therapy (CBT) to talk through experiences, as well as exercise programs to help keep active and reduce pain. Exercise such as walking, swimming or cycling can increase your endurance and help daily functioning. Deep breathing exercises or meditation can be just as effective, as it can ease muscles and also allow you to sleep better at night. The condition can affect anyone, but surprisingly is 7 times more common in women than men. It usually affects those between the ages of 30 and 50, but those of a younger age are still at risk. Some estimates suggest nearly 1 in 20 people may be affected by fibromyalgia to some degree. The Mayo Clinic also states that if there is someone in your family who already suffers with the condition, and it may make you more likely to develop the condition.